Good morning, everyone. I have an opportunity to give a lecture at the University of Diponegoro, Sumaran in Central Java, Indonesia. So I would like to share what I'm going to talk about. So everyone who may be interested in um, my lecture or presentation could also watch again online. So the topic given was international standards and social protection in Indonesia, quite broad. So I will start by giving an overview of what is social protection and what is the actual coverage in Indonesia, followed by the real example of the ongoing discussion on the pension reform in Indonesia and how it's related to the international social security standards or international labor standards. So what is social protection? Many organizations use different terminologies. Many countries use different terminologies. Some countries said social protection includes social security and social assistance. Other countries say it's social protection is the same as social security. So in the ILO, it doesn't really matter. Whenever we say social protection, we also mean social security. We use these terminology interchangeably. We don't really specify what it is, but we are talking about the same thing. The reason why many countries try to separate the terminology, social protection, social security, social assistance, uh, they try to differentiate the source of funds mostly. Like Indonesia, some countries use social insurance uh, and the social security with the same meaning. When people contribute to the social security fund, social protection fund, they call it a social insurance or social security. While when Indonesia talks about tax-funded schemes, it uses the terminology social assistance. Or we could also say contributory or non-contributory scheme, or tax-funded scheme and a contributory scheme, depending on the source of funds. But here in the ILO, we take a life cycle approach. Um, so we really don't differentiate schemes by the source of funds or terminologies by the source of funds. So let me explain what is life cycle approach of the ILO. Social protection or social security should be provided by the state, country, the government, to the people throughout the life cycle. When women get pregnant, they must have a maternity leave, and during maternity leave, they must have a regular income from the state. That is maternity benefit, maternity leave cash benefit. When people, and then when they deliver the babies and they start raising the children, the family must receive some kind of benefit, allowance benefits from the government social security system. That is called family benefit, child benefit. Sickness benefit is something you can receive from the government social security system when you get sick leave. When you start working, you would be entitled to receiving regular income, even though you don't come to the office and work. That is called sick leave. And during the sick leave, the social security system must compensate part of income, partial income from the social security fund. That is sick That is a sickness benefit or sick leave cash benefit. When you are unemployed, you, you can receive benefits from the states, that is unemployment benefits. When you get injured, when you get ill because of your work environment or during your working hours, you must receive employment injury benefit. That may include a disability benefit, or if you die, your children, wives, husbands could possibly receive pension, annuity income from the employment injury benefit scheme. When you are disabled outside the workplace, and then you can probably receive a benefit, disability benefit from the pension fund, that is disability benefit. Or when you have a disabilities by birth, since the babies, the state may provide a tax-funded benefit that is also disability benefit. Survivor's benefit, when you passed away outside the workplace, your wife's, husband, and children may be able to receive pension, survivor's pension, widower's pension, orphan's pension from the pension system. Old age benefit is called the pension usually. And when you retire and reach age 65, 60 years old, you may be receiving benefits from the states. When you go to the hospital, you may receive a free medical care, or you just pay a little, like 30%, 20% of the medical costs, and then you receive the full service. That is a medical care. Here, we have a health insurance system nationwide. So that is a life cycle approach. So the important message here is that it doesn't really matter the source of funds, but it matters what benefits are provided throughout the life cycles. So what is the risk in the actuarial world or social security world? Risk is something that may happen in your lifetime unexpectedly. And then that happens for everyone. So that is a common risk for everyone, like a death, injury, even giving birth. You may think it's not a risk because it's a good thing, right? But in terms of income, it's unexpectedly happen. You cannot predict when you get pregnant. And suddenly you need the income because you cannot work during a maternity leave period. Then you need some sort of income, regular income every month. So we call it a risk. And then it is common for everyone, and it's unexpectedly happen. You cannot control when it happens, and then it's costly. It reduces your income. So someone needs to compensate that income loss. Otherwise, you would have to rely on yourself, your family, or transfer, or you may have to withdraw your savings. To avoid such situation, everyone could rely on the social security system to mitigate such risk when it's exposed. Financing. Here is an important concept, a risk pooling mechanism. Workers and employers contribute to BPJS employment, Social Security Office, and that is social insurance. And in this way, the risk is pooled. Everyone contributes to pool the funds, and then this fund will provide benefits to everyone when something happens. So we call it a risk pooling mechanism. Sometimes the states provide that, the tax subsidies to the fund, or when the fund goes the fund faces difficulties in paying somehow, then the states must play the role to backstop, so uh, providing tax money to the fund so that the fund can continue paying benefits to their members. The benefit, what is social security benefit? It can be cash, mostly cash, but it can be also in kind. For example, in case of work injuries, they may receive, let's say, some devices to support you to walk properly, wheelchair, or some kinds of materials to help you during rehabilitation. So income provisions are also common for some possible measures. So what is the international social security standard, international labor standards? When the ILO social security experts come to talk to you, we always talk about 9 different social security schemes that I shown you in the very first slides with the illustration. That is not something we think the best, but that is the list of social security branches that is provided by the Social Security Minimum Standards Convention number 102 that was adopted by the ILO member states in 1952. So we always refer to these Social Security Minimum Standards Conventions when we explain what is Social Security and what needs to be done and how it should be designed, because this is the international Social Security minimum standards. So that is a reference to set the bottom line of any Social Security systems in our view. So there are 9 contingency Social Security branches listed in the convention, and each sections of the Social Security minimum standard conventions have higher conventions that are listed on the right-hand side. And these higher conventions provide higher benefits or more generous package of Social Security schemes. For example, unemployment benefits are stipulated in the Social Security Minimum Standards Conventions, but that benefit level is, for example, increased from 45% to 50% if we refer to the higher standards convention 168. So that is the relationship between the minimum standards convention and the higher convention. So let's talk about the Indonesian case. Indonesia has these schemes listed on the second right column. Medical care is provided by the National Health Insurance, JKN. Unemployment benefit is provided by the BPJS employment scheme called JKP. And old age benefit is provided at Jaminan Pension under the BPJS employment. BPJS also provides JKK for employment injuries and illness. Invalidity benefits, disability benefits, and survivors benefits are provided by Jaminan Pension, JP. PKH, PKH, this is tax-funded, the means-tested scheme, proxy means-tested schemes provided by the Ministry of Social Affairs to poor children and their households. I put JHT and the JKM in the bracket because strictly speaking, according to the Social Security Minimum Standards Conventions, we don't recognize these schemes as Social Security schemes because Social Security's benefits need to be periodic payments until the contingency lasts. So when you until you die, the pension should be provided, for example. However, JHT is designed to be like a bank savings with a better interest rate. So it has an individual account defined contribution scheme. So it doesn't have a design to pay to pay until people die. Jihate fund will pay you until you exhaust your savings there. So that is not Social Security according to the Minimum Standards Convention. Similarly, a JKM that provides lump sum payments to like funeral grounds, etc. So I put it in a bracket. But I'm not necessarily criticizing these schemes' effectiveness, but just strictly speaking, these are not Social Security schemes according to the Social Security minimum standards. The labor law also provide guidance coverage for sickness benefits here. Unemployment benefits is also provided in the form of severance pay, statutory severance pay, and maternity benefits are provided by employers. So these are employers' liability schemes, and employers are liable to pay directly to the beneficiaries. However, the Social Security minimum standards requires the Social Security fund to pay, the government states to pay these benefits, but it shouldn't be provided directly by employers to the beneficiaries. So with this concept, requirements, sickness benefits and maternity benefits are missing in this country. So I will discuss it later, but the next step for Indonesia is to create these schemes as part of, let's say, BPJS employment, in our view, to replace this employer's liabilities under the labor law number 2003, number 13, need to be replaced by the social security schemes, collecting contributions additionally and pay the BPJS employment pay to pay the benefits to workers, possibly through employers. Non-wage workers, for non-wage workers who do not have employers, they have access to JKN, JKK. That's it. If they are poor, they have access to PKH. However, because they do not have employers, they cannot take a sick leave, and they don't have a concept of unemployment because they are not employed by employers. They do not have a maternity leave because they do not have employers. Also, they are not covered by any pension schemes here in Indonesia by law and by policies that provide a coverage gap in old age benefits, pension, old age pension, invalidity benefits, in disability pension, survivors benefit, survivors pension. Of course, they do not, because they do not have employers, they do not have employers' liability schemes, such as severance pay for unemployment, sick leave benefit by employers, maternity leave benefit by employers. They do not have such benefits. Among BPJS employment schemes, here is the summary of legal coverage. By law and regulations, all workers, including wage workers and the non-wage workers, must participate in two schemes, including JKM and JKK. That is mandatory. Employment insurance or unemployment insurance is mandatory for those who work in large, medium, and small enterprises, and voluntary for micro enterprises. JHT is a mandatory for large, medium, small enterprises, but voluntary for micro and non-wage worker. Pension provides coverage only to employees in the company, but allow employers of small and micro enterprises not to register their employees unless they would like to do so voluntarily. From the international practices or standards perspective, so we observe many countries fail to extend the coverage if the scheme allows voluntary participations. For example, JHT, Jaminan Hari Tua here in Indonesia, is voluntary for micro and non-wage workers. Do you know how many non-wage workers register with JHT? If I remember correctly, the latest publicly available data show only 600,000 workers register among 70, 80 million workers in self-employed. So it clearly shows voluntary participations, voluntary coverage doesn't really extend coverage drastically. And that is also our international experience with the ILO. So it is important to extend the legal mandatory coverage to all employees in general in the companies, and then also create the scheme to allow our non-wage workers to participate. Mandatory basis, basically. Voluntary, it's possible sometimes. For example, JKK can be voluntary through the intermediary agency, for example. Japan had such a scheme. It's possible. But in general, mandatory coverage, expanding mandatory coverage is a way forward. Contribution rate, here is a summary. Workers and employers share the contributions and accept the JKP. Non-wage workers have a different flat contribution rates. I have to revise the JKN because now it has been revised these days. Construction workers can only participate in JKK and JKM by the project, construction project. They are not allowed to participate in other schemes. There are 8 million construction workers in this program who are automatically excluded from other schemes. The overview of available social protection schemes in the region. Malaysia and Indonesia are only the two countries that do not have maternity benefits. So filling this gap by creating a new scheme would be the next step forward for Indonesia, and also sickness benefit. Otherwise, with a lot of efforts of BPJS and the government of Indonesia, there have been enormous progress in the development of new schemes in the past 10 years. The pension schemes were created in 2015, and unemployment benefit scheme was created in 2021. So in the last 10 years, the number of circles increased drastically for Indonesia. So I trust Indonesia could move forward by creating maternity and sickness benefits next anytime soon. And we're happy to support. Effective coverage. So now the question is actually how many people are receiving benefits in lifetime, during lifetime. As I explained, we look at the life cycles. We have regular updates on the ILO's database. The ASEAN and Pacific regions do pretty good job compared to other regions. The world average is 47% of populations are receiving some kinds of social protection benefits, while the ASEAN Pacific shows 44%, so it's close to the world average. In terms of the children receiving a social protection benefit, Indonesia is at the middle, 27% of children receiving social protection benefits, mostly from PKH, because the pension coverage is quite low, survivor's pension, from jaminan pension, taspen, and asabri. That is still low. So mostly from PKH. So this is the results of huge investment in two decades in this proxy means tested schemes in Indonesia. Maternity benefit. Here's an indicator. Mothers, the share of mothers with new babies are receiving social protection benefits. Indonesia is ranked relatively low. I guess, I trust this number will drastically improve if Indonesia introduced the new maternity leave cash benefit schemes. It doesn't have such benefit. The share of persons with severe disability receiving social protection benefits. So this is an indicate proxy for disability benefits. Indonesia is ranked at the bottom, almost bottom, because it doesn't provide disability benefits widely. PKH provides a top-up to the targeted households if they have persons with disabilities. But it doesn't directly target the households with persons with disabilities. Similarly, the number of disability pension recipients of JKK and Jaminan pensions is still low. So the number of persons with disabilities quite low here, receiving social protection benefits. Unemployment benefits. We haven't updated our database, so it shows 0, but certainly the Jaminan Kehilangan Pekerja JKP program started 2 years ago, and it provides benefits, I think more or less 30,000 unemployed workers every month. So if you multiply it by 12, that would give 360,000 unemployed workers receiving benefits for 12 months out of about 6 to 8 million unemployed workers. So the coverage is anyway very low. It's not only because the BPJS performance is relatively low. I don't think that's the main reason. but rather also the labor market structure. About half of unemployed workers here in Indonesia are the first-time job seekers. Out of half the unemployed workers are the first-time job seekers. So they are not eligible for the JKP because they do not have contribution history. So they are not BPJS members. Also, the JKP has quite a lot of restrictive measures in the policy designs. So by implementing that policy, BPJs cannot make further efforts to extend the coverage, extend the number of claims, because BPJS is the organization that implement what the law and regulation says. So when the laws and the regulations are wrong or too restrictive, the Social Security institution cannot increase the number of claims. What they could do is simply to to let people know how it works. Work injuries, the coverage is still low. Yeah. Old age benefits, still low. The number of people who are who are contributing to the pension system. This is a really important indicator when we talk about 2045 golden Indonesia, because when the demographic bonus ends and Indonesia will enter aged society, not aging. Aging started last year, and Indonesia will aged by 2044 in our estimates. So by 2045, Indonesia would have a silver economy when it when the country talks about the golden Indonesia. So the reason why I stress this indicator is quite important is this shows this indicates how many actually people would be eligible to pension benefits when they retire in the future. Currently, only 16% of labor forces are paying contributions to the pension schemes. That means most people will retire without pension. Who will uh, who will pay their basic needs in the future? Let's talk about pension because this is a really hot topic today, and the discussion need to be completed by January. A Peru-Escal law was adopted 2 years ago, and that includes the reforms of JHT and the Jaminan pension that need to be completed within 2 years. That means the middle of January is a deadline, unless the Ministry of Law exceptionally approve the extension of the period for the Ministry of Finance to regulate this government regulation to implement it. Let's talk about pension. Why it's important, and how the international labor standards are used. But before that, I'd like to introduce myself. I forgot to do so. My name is Ippei Tsurugaf, coming from the north parts of Japan, a rural village with 6,000 residents, and most of them are old people, senior citizens, above 60 years old. We have 30,000 livestock. The main industry is agriculture. That is my home background. And I'm 40 years old. I have both father and mother still alive, healthy, and they are 72 years old, 70 years old for mother. And the three grandmother and the fathers passed away. and one grandfather on the mother's side still alive. He's in the care home facility, public care home facility now, but he can still talk, healthy, and still receiving pension. This is family structure, and most of my family members happily, unexpectedly live longer. That is our family structure. I have one brother, younger brother. He's a, he's a pharmacist in Tokyo. In our village, we don't have many jobs available, so it's really common to look for job outside our hometown. So I only go back to my village once a year, and my brother is the same. After the graduation of high school and college, we always work, go to work, go to get the job and work, find the jobs in the urban, uh, usually capital in Japan, because we cannot find the jobs there. So we live separately, family. But my father's and the mother's generation certainly lived together with their parents. But because the demographic structure changed, we had too many young people in the past, and we had a lot of unemployment problems, and and then we had to look for jobs outside the towns, and that's why I migrated to the urban city Tokyo and find a job. And now I'm even working abroad. Um, I cannot go back to my hometown because there are no jobs available. So the demographic changed, led to change the labor market structure and the family life, because I didn't have a choice to live with my parents because of this situation. Anyway, Japan, my home country, Japan. In 1970, when my mother and her father started working when they were young, my mother started working after the graduation of high school. My father luckily went to uh, college, and then they started working in the same place, agricultural cooperative, the best employers in my town. They started with the 4 million rupiah per month wage. And then when they retired in 2000, their salary increased to 40 million rupiah equivalent. During that time, they enjoyed the high interest rates between 5 and 10%. So this situation is quite similar to what we experience in Indonesia today. The average wage is 4 million rupiah, and they may end up their career in 30 years' time, slightly more or much more wage. And you are currently enjoying high interest rates. So the situation is quite similar to my mother's generation, father's generation. When my brother and I started working in 2010, our initial wage was 20 million because we were working in Tokyo. If we had to work in our village, probably our income was around 50 million, more or less. My brother is working in the hospital, the university hospitals, as a pharmacy, and he may end up his career with the 40 million rupiah per month, most likely. That's average wage in Japan. In our generation, we don't enjoy high interest rates. We have zero interest rates or even minus interest rates If you deposit, you lose money. Bank will take it, and then bank will pay to the central bank. That is our generation. My mothers and fathers, of course, couldn't expect that this would happen in my generation. So that was our challenge in Japan. So the question is, can you imagine today what will happen 30 years later? It may happen the same thing. The same thing may happen in Indonesia. We never know. And of course, the living costs increased drastically. It's roughly about, it became doubled, while wage didn't grow from my mother's generation to my generation. The number of children got fewer and fewer, and we have more older citizens because my parents and my grandfathers live much longer than the past. They don't die, they don't pass away. So younger generation will have more parents and grandparents to take care of. And what can the pension system do in Japan? The pension scheme in Japan for wage workers were established in 1940 during the war, only for seamen. And then it was extended to blue-collar men and women and office worker during the war, towards the end of the war. There was, of course, some background. The government had to collect more money from the people to finance the war. That's another reason. But anyway, we had some kind of basis for the pension system. The pension, the universal universal coverage of the pension, such a scheme started for all residents in 1960. So the extension to all citizens was established in 1960. Japan got independent from the USA in 1952. So 8 years after that, Japan started national pension system, including self-employed, all citizens, including housewife. My grandfather was farmer. He cultivated the lands, cut the tree, and opened the land and started farming. On my father's side, my grandfather and the mother had a small toko grocery store, so they are also self-employed. All of them were participating in this national pension system. This scheme is contributory, so when they become age 20, all citizens must start paying pension contributions to the national pension scheme. Half the expenditure of the pension fund will be provided by the states. So it's half tax funded and half contributory. It looks like this. We have 3 layers. The bottom layers provide the guarantee basic pensions for all citizens. If you work in the companies, you have the second layer, just like a jaminan pension. If you would like to contribute more, because you want to have more regular income in your retirement life, you can optionally pay additional contribution to the third layer in the shade. It's like Jamina Harito. So we have a multi-tier pension system like this. Indonesia doesn't have this. Indonesia has second and third layers only. So I have been discussing the issue on pension and provided recommendations, options for reforms to our ILO partners. And this is a very common Reactions I receive. People say it's not urgent. Indonesian people enjoy today. However, there is no time to waste actually. France took 115 years for the transition from aging society to aged society. The USA took 69 years. Japan took 25 years. That was fast. Vietnam, Indonesia will experience even faster transitions. So it means the aging is rapidly happening, and there's no time to waste. If we start today to create the pension system, the cost is cheaper, contribution may be lower. But if we postpone our decision to create the pension system by 5 years, even 1 year, the contribution rate will go up and up. The situation will never be better. I have a savings. I can pay. I don't need to pay contributions. That's another comment I receive. Let's take very simple simulation here. My retirement planning. Older persons. Okay, when people live up to 60 years old, they have the life expectancy 80 to 83 years old. So when you so that means after the corporate retirement age of 55 here, 55 years old here, people will have to self-finance for 25 years to 28 years. Do you have income? You really don't know how long you will live, but the life expectancy is 25, 28 years. You need to pay. Sorry, 20 to 23 years, you will have to pay somehow. Do you have savings? If you spend 3 million rupiah every month today and ignore inflation, ignore whatever other aspects, if you just simply multiply it by 25 years, you will have to have a 900 million rupiah in your bank account when you retire at the age 55. Otherwise, you will have to rely on someone's uh, transfer, some supports. How much does Social Security scheme pay to you in old age? JHT will pay you 102 million rupiah if you work for 30 years without break and your average earnings was 5 million. JHT will give 203 million. JP will provide you 1.5 million rupiah per month until you die. So if you die at the life expectancy, then 270 million rupiah will be provided. But then you still have 530 million rupiah gaps. So you may have to have that amount of savings separately, or you need to other income sources, like children need to transfer to you 530 million until you die. And the pensionable age are different one to the others. That's another issue. You can start receiving JHT earlier, but JP later. So if you cannot have a savings, the solution that the world found in its history was to create a good pension system. The jaminan pension, however, has low income replacement level, benefit level. The Social Security minimum standards required at least 40% of previous earnings should be provided if you contribute for 30 years. But the pension design of JP provides only 30% of wage after 30 years of contribution. JHATE doesn't have such benefit. Its savings then provide a lower benefits with higher contributions. My children will take care of me then. They will pay 530 million. Is that true? Let's see. In the father's mother's generation today, I have 6 working age populations for 1 older person. Okay, that's fine. But 30 years later, 25 years later, 3 working age population will have to support 1 older person. If we talk about absolute numbers, this is our projection. Today we have 27 million older persons above the age 60. The number will go up to 70 million older persons by 2050. Can the sandwich generation pay them 530 million rupiah until they die while they are taking care of their children and themselves? Pension can help me. Okay. The coverage of pension is one of the lowest in Indonesia. We need to expand the coverage so that in reality, the pension will not help you for most citizens in Indonesia. That's why we need to reform the pension. Something wrong there. If we talk about the absolute number of people who are contributing to any kinds of pension schemes today, I included JHATE as well. Among economically active populations, there are 56 million wage workers in working age and 55 million non-wage workers, 7 million unemployed workers. Only 13 million workers are participating in JP. Asabri and Taspen have 5 million people in their membership and 17 million JHATE. Non-wage workers are covered only little, I think 600,000 in the latest figure. Unemployed workers are out of coverage. Students, housewives do not have a coverage. But all of them will equally become old and require a regular income in the future. Then when I talk about let's improve pension coverage and the benefit level, workers and also employers, organizations tell us, oh, I cannot afford to pay more contributions. However, what Indonesian people are paying today is one of the lowest in the region. Singaporeans paying 37% of wage every month. Malaysia 24% plus 1%, 25. Vietnam's paying 22% to pension fund. Japan 18.3% plus a flat additional Jaminan Pension Nasional contribution. So Indonesian population workers are paying only 8.7% to JHT and the JP. There are rooms to increase the contribution rates. If the tax burden is exceptionally high, we haven't analyzed that. That's a different story, but I really doubt so. So there may be some more rooms to improve the contribution rates. Indonesia is quite unique, different from other countries. We have the large informal economy, so we cannot compare ourselves and other countries. This is a really common statement I receive. However, Brunei, Timor-Leste, Thailand, Vietnam also have a high informal employment. but they had a much higher coverage in the pension. Why Indonesia had low pension coverage? It doesn't really, this statement is not really true if we only look at this. So we need the multi-tier pension system that I showed you in the previous slides. The reason why the Brunei, Timor-Leste, Thailand have the high pension coverage is not because they are doing great, but also they have a good pension system by design. I shouldn't say good, but because of design, they have high pension coverage. Brunei pays about 3 million rupiah per month to all citizens above 60 years old by tax. So of course, the coverage is 100%. Timor-Leste have the similar mechanism. Above 60 years old, you receive pensions every month from the government by tax. Thailand have similar schemes. Above 60 years old, except civil servants, you can receive pension from tax. That's why their coverage is quite high. Indonesia doesn't have such scheme. We call it the social pension, jaminan sosial. Vietnam provides such benefits above age 80 by tax. If you are somewhere between 60 to 79 years old, you also receive a tax-funded benefit. If you are poor, if you do not have family support or no caregiver, you can receive such benefit if you're poor. So we need something at the bottom here. Indonesia doesn't have the universal pension at the bottom. We have provided several recommendations in Indonesia. It looks very complicating, but the question is how to establish the social protection floor or universal pension tier or scheme. And depending on such a design, we need to also reform the design of Jaminan Pension and Jaminan Hari Tua. This is option one we provided to the government of Indonesia. You must contribute on a mandatory basis to Jaminan Pension if you work in the company or if you work as non-wage workers. You must contribute, not voluntary, must contribute. At the end of your career, if your pension amount is lower than 500,000 rupiah, you will at least still receive 500,000 rupiah. That money will be provided by the state's tax fund plus Jaminan Pension Fund. If you had a zero contribution history, you will still receive 500,000 rupiah by the state budget. If you have a 10 years contribution to JP and it doesn't reach 500,000, your JP contribution will be the JP fund will compensate some, and then combined with the tax fund, then you will still receive 500,000 rupiah. If you have, and then of course, 500,000 rupiah is the about 40% of average minimum wage in this country. That's why we set this figure. And 40% is guaranteed by bottom tier. Jaminan pension will be provided to workers in the company and also self-employed. And the level of benefit should be also improved, because 500,000 rupiah may be too small for many people, but it can only guarantee the minimum standards of living. And to do this, the states need to spend 120 trillion rupiah to cover all citizens above 65 years old. The simpler option is social pension, pension social. Just simply provide 500,000 rupiah for everyone above the certain age. And if you work in the company, you will participate in Jaminan pension. That's option 2. Option 3, Jaminan pension national. This is a Japanese model. When the Indonesian citizens become the age 20, they would have another obligation to pay contribution to Jaminan pension national, just like Japanese. 300,000 rupiah flat amount contribution every month to the pension system. And on top of that, if you work in a company, Jaminan pension will provide you more benefit. In this case, 1 million rupiah will be guaranteed every month by Jaminan pension national. So Jaminan pension contribution doesn't have to go too high, because the pension amount doesn't have to be improved. Anyway, so the government could spend about 120 trillion rupiah if they would like to cover all citizens above 65 years old. And that budget amount is roughly 25% of the national social protection budget. If it's too high, they could start with the age 75, and then the budget require will be 36 trillion rupiah. So there are many options, and the government will increase VAT by 1% in January next year, and that will generate additional 70 trillion income to the government states, and that amount will be sufficient to finance this bottom tier. So the wider discussion will be required, and it's important moment to do so for the Indonesian citizens. Thank you very much for listening. It was slightly longer than I expected, but I hope this was useful and you enjoy. Thank you very much.